Good morning, everyone. Can you guys hear me okay? Yep. Okay. So we had the workshop yesterday, Prescriptions in Innovation, Patient Engagement, and it was a full room. We had a really great time, lots of contribution from everyone. I'm Tony Pashley, and I'm the VP of Product at Sharecare. And at Sharecare, we really work on the product side it's an intersection between design and technology. So we're really focused on how do we create the best solutions for users, the patients, the consumers, and really get them engaged. So in yesterday's workshop, we started with the end user. We started with the patient. We know all patients aren't alike, but we started with Bob. So as a team, we all talked about Bob, his condition. He was diagnosed as pre-diabetic. He has, showing some behavior of depression. He's lethargic. And really we were talking about sort of what are the problems that exist today in the system. So this was a really great moment for the entire workshop because we all really focused on the system and we said, you know what? This system that we're showing where all the situations and where all the breakdowns, it's really broken. And actually everybody had a really great discussion around that. What we wanted to do was focus on some of those breakdown moments and come up with some innovations to really improve patient engagement. So to do that, we used a method called a charrette. So this is a design method, and what it does is it breaks everyone up into small groups of 3 or 4, and then based on timing, we switch. So everyone sort of cross-pollinates across the room, sharing different ideas. I call it speed dating for ideas. So it's kind of fun, it's energetic. Everybody's really coming up with these different unique ideas and then sharing them across the groups. So the most amazing part of yesterday was that we came up with 15 ideas in 30 minutes. That's pretty powerful. Think about if you have a whole day, how many ideas you could generate. So everybody came up with these ideas, and what I've done is I put together the big ideas from yesterday. And again, I think a key thing is we looked at the overall system, but we're really focusing on the moments or the situations that we could improve. What are those ideas, the innovations that we could help with patient engagement? All right, so this one's an easy one, right? We talked a lot about when someone gets the diagnosis and they're told, you need to exercise, you need to be more active. Well, what if a doctor actually handed someone a prescription, a free membership at a gym? So basically they could take this to any gym they wanted, and then for the first 10 pounds, it's for free. So it's basically encouraging them, and it's reducing that cost factor, sort of that limitation that gets them from going to the gym. But that's not the only idea. The next one, and we spent a lot of time talking about this, it's when someone is told their diagnosis. Sometimes the language, they're not understanding it. Sometimes they just zone out because they can't believe, they're sort of in denial about what they're being told. There's a statistic that says 48% of patients, when they're with the doctor or when they leave the doctor's office, don't even recall, or actually it's 48% remember, but then the other 52% can't even recall what happened during that doctor visit. So it's how can we provide the right information, provide the right sort of solution when they're in the office so that they understand what they're being told. So they walk away from the visit with sort of next steps, things that they understand. So this idea of a care coach would be someone that would be there to help them and explain the diagnosis. So this is actually something that I didn't know was a big problem, but I learned from the team yesterday. We were talking about prescriptions and that there's a big breakdown when someone leaves the doctor's office to when they actually get to the pharmacy to fulfill the prescription. So what if, this is an idea, what if the doctor could actually look up according to your insurance and say, oh, actually, they can't fulfill this prescription, so I shouldn't prescribe it to them, or if it's too costly. So a way for a doctor in the office to check and see, if I prescribe this, is your insurance going to cover it? And then our last big ideas were around shopping and around nutrition. So in this case, what if you could take a photo using your smartphone you're in the grocery store, you're at that decision point with, should I do this or should I do that? Actually take a photo of your grocery cart and then send it to someone to get the advice. There's actually a really cool app right now, so this isn't too far off as far as technology, called Rise. And with Rise, you can take a photo of your grocery cart, and then you could send that to your nutrition coach. So this idea of I'm in the situation, and how can I make the best decision? And then the last one, again, focus around nutrition. So if you're diagnosed with you're pre-diabetic, and you're in the grocery store, and you're trying to decide between making smart decisions around what you should purchase, how could you have a shopping list? So we can imagine this, right? You have your phone. I mean, there's some great recipe sites out there. Why couldn't we have a site, just a mobile application, that had your information, and then you could basically have a shopping list of what you should purchase when you go to the store? So really simple things that we could do, innovations at the right moments that could really change and hopefully improve patient engagement. And just want to thank everyone in the workshop. Everybody did a great job yesterday. And please vote for us.